WhatsApp group. Uh, so over to you.
Okay, perfect. Thank you so much, Ubaid Rahman. I hope you guys learned something from this Walid. I'm a graduate of Khyber, as mentioned earlier. Uh, I'm currently doing some research and preparing for my next exam, and yeah, I'm doing that. So I think it's a good opportunity for you guys to ask any questions that you guys might have about research or about medicine in general, or something that specifically that you want to ask. No, I won't be able to answer specific questions later on, but if right now, it's I can see Basit Wakil as well. He was with me in Karat College. So I'm glad to see you in medicine now. So anyways, so thank you very much, guys, for yeah, so for arranging the session. And Obed, do you want to start with some specific question, or let me know what part of research in uh, USMLEs do you want me to talk about? Obed, are you with us?
I would like to ask the question. I guess there is some issue in the connectivity. Ubaid
Okay.
will jump and he will host obviously. But I was started the question. सर कहते हैं कि मतलब यूएसएमएलई की जर्नी के लिए रिसर्च होती है बहुत कंपलसरी होती है तो लाइक व्हाट अमाउंट नेसेसरी है यूएसएमएलई स्टार्ट करने के लिए मतलब मैचिंग में आपका गुड मैच के लिए कितना एवरेज होना चाहिए उसके बाद ये कि देयर इज अ मिथ के सर्जरी रेट अगर आपको मैचिंग चाहिए तो यू हैव टू डन ऑल रिसर्च इज लिंक्ड टू द सर्जरी इज इट ट्रू
Yeah, okay, that's a very good question. So, basically, in the journey of USMLE, when you want to pursue medicine or surgery in the US, definitely research carries a good impression. If you have something in research, that would be good. However, subjective thing, like it's not necessary to about surgery. What I would like to mention is surgery mein, there is something called a research position. Research position is when you're in the US and you're working in some institution on a paid or unpaid position for a year. You're specifically directed towards a specific surgical field. You're doing research with some principal investigator, and then you write papers with them. So that's something that at times, most of the times, is something they uh, give a huge value when you are pursuing surgery. However, in medicine, it's not necessary. To be very honest, so basically, I'll divide it into two. Number one is the requirements. For example, you have to take step one, you have to take step two, you have to do OET, occupational English test, and certified to be able to apply for residency. However, research, clinical rotations, and leadership roles, leadership skills, communications, all things which will increase the impact of your application and make your application better. However, they are not requirements. No one can refuse your position because you didn't have a publication per se or something like that. So research may, for example, when you're applying for residency, there is something called ERAS application. So it stands for some electronic something application services, right? Residency application services, I think. So in that, when you open ERAS application, you have to make a CV, and in that you have to mention your background, where you're from, your phone number, your email, your and then they ask about your clinical experiences. Okay, I had clinical experience, I had research experience, I had something volunteer experience, community surveys, something like that, leadership roles. And then there is a specific section for publications, right? Publications. So publications, that's where if your CV is publications, it's not the best impression, it's not a requirement as such. have something over there, it's a good thing. For example, I wrote a case report and I published it with a few friends. That can go into my case, my publications. Then I wrote a editorial letter to the editor of a specific journal about some specific thing. It went in and got published. And then I wrote a review study, an original study, cross-sectional, systematic, sorry, excuse me, systematic review, meta-analysis. All of them, they go into the applications part of your application. And then there are certain poster presentations, oral presentations, which you can, for example, if you see there are around in Peshawar Medical College, Shaukat Khanam, Khyber Medical College, and Khyber Girls Medical College, and you go there, present your research paper, the abstract, and it can go into the oral or poster presentations in your ERA CV, right? So to answer your question, yes, research would help you if you have something on your CV. But if you're asking, is it something absolutely necessary? My answer would be no, it's not. But if you do that, it will increase the impact of your CV. The thing about surgery is, then ye to publications ho gayi, like you did a publication, case report, letter to editor, review study. Then there is something when, but you do all of this when you're preparing for your exams, when you're a medical student, or when you graduate. But there is something which is a dedicated research. For that, you come to the US, you're staying in a university or some hospital or some institution, and you're doing research with that specific department. That's called a postdoctoral research position, clinical research affiliate, or anything, postdoctoral research fellow or something like that. That is like a whole year or two. It could be remotely, it could be on site, it could be something hybrid. You go at times and then you're working from home with them. So you have a specific team meetings, you're discussing specific projects, and you're publishing papers together in that institution with that, and you have access to the institutional department, to the resources and everything. That sometimes, or most of the times in surgery, yes, a lot of people do that, and it's kind of now a requirement. You can say if you want to pursue surgery, then you have to have a bit of a higher research profile, a more dedicated one. It's not like in medicine, you can write a case report. In surgery, you can write it. In medicine, you can write. In psychiatry, it could be anything, and at the end it will benefit you to some extent. It's good to be focused. Well, all papers are in cardiology, so it will have a good impression that okay, this guy is interested in cardiology. But generally, I was talking earlier to the guys as well. So when you're entering your residency, when you're giving your interview for internal medicine residency, don't talk about like cardiology, gastroenterology, hemonc, or stuff like that. Talk about medicine. So I want to enter medicine, and then I'll pursue further fellowship in cardio or whatever. So it will help you not only in residency application, but so this is another point. Research, whatever research you do right now, more than your residency application, it will help you in your fellowship application. Because fellowship, so if someone doesn't know, there is 3-year residency internal medicine, and then there is like a 3-year fellowship of cardiology, gastroenterology, 2 to 3 years depending on what you're doing. So and surgery, it's a bit different, like 4 or 5 years of residency and then a few years of fellowship. Some surgical are more lengthened, like 5 to 7 years. So then when you apply for fellowship, for example, you're applying to cardiology fellowship, then you have to have like strong research profile in cardio. Or no, some people even go into cardiology without any research or specifically like strong research, but they prefer it. For fellowships, yes, you have to have you can't have like 100 papers in oncology and you're saying I'm interested in cardiology. It doesn't make sense. But for medicine, anything would work. So to answer your question, whatever you guys are doing at college, these research committees, students, and whatever research conferences, oral presentation, poster presentation, your publications, whether, so you can even put publications which are not yet published. For example, you wrote a paper with some friends and then you submitted it to a journal. There is a portion called published papers, and then there are other than published. It could be, for example, let's say you submitted it, it's under review, or it's accepted but not yet there online. In fact, you can even mention your newspaper article. You wrote an article for newspaper, you have a CV. You wrote something for your college magazine, you can write it in there. You write something scientific, you wrote something for a website, anything, very ERA's CV is very diverse. You can have anything and you can put it in some way in the experiences or a publications part. So anything you do towards research, whether it's a conference, whether it's but try to be more on the doing part rather than observing part. For example, not just going to conference, but actually submitting an abstract and presenting it. You can then mention it on your ERAS CV, right? So I hope that answers your question. There are still a lot of things that need to be discussed, but this is a good icebreaker to start with and give you a general overview of what the world of research is. If you can give me 1 minute, I'll be back. My laptop charger. Okay, I'll be back.
Parag, your mic is mute. Where can you hear me?
Yeah,
The mic was mute.
yeah, I'm with you.
Okay, yeah.
सर एक फ्रीक्वेंटली आस्क्ड क्वेश्चन है कि ये ऑनलाइन सर जो कोर्सेज होते हैं ना, तो सर ये ऑनलाइन मतलब लेक्चर्स होते हैं 1 और 2 आवर के, और सर ये CME आवर्स भी हमें प्रोवाइड करते हैं और हमें सर्टिफिकेट भी देते हैं, तो सर इनके कोई मतलब CV में कोई इम्पोर्टेंस है?
Yeah, that's a very good question. So ये मेरा भी question था when I was doing. So yes and no. So yes, because you learn or anything. I said, you're doing this session, I'm learning from you guys, you're learning from me. This is something important, right? Nothing you do in academics goes to waste. Remember this thing. But you said CME, which means continuing medical education, right? So usually, currently you are med students, right? I assume almost we have over 70 people here, and I assume all of them are med students, right? So you're already pursuing medical education. What does continuing medical education mean? Continuing medical education means now you are graduate, right? You're not actively going to med school. How are you continuing to study medicine? To gain knowledge, right? Because some people, they graduate and then they lose track of medicine for years, right? So everywhere they'll prefer people, wherever you go, not just the US, not UK, anything, wherever you go, anywhere in the world, if you're applying for training for a job, they will like you if you don't have like gaps in your medical education uh, profile, right? So for example, you're graduated now, you're doing house job, or you're out of your house job now, and you don't have a training right away. What are you doing in that time? So to continue your medical education, to stay in touch with medicine, you attend conferences, you attend seminars, workshops, and these CME hours, right? These are the things which will benefit you later on in organizational work. To be honest, I don't have a very specific idea of what exactly can you use it for. The number of hours you attended a big conference like American College of Physicians, and it gives you like over 100 hours, right? And I don't know where exactly that goes, but my assumption is that it's something for post graduation. It's not something for you as medical students. However, I would encourage you to join, attend, avail any opportunity. If it's about research, if it's about artificial intelligence, if it's about any software that they are teaching, any meta-analysis, systematic review, case report, whatever, because at the end of the day you have to learn and do something on paper, right? That you can put on paper. You cannot put in ERA CV that I attended a review course, systematic review. You can put it on LinkedIn, but it's not the best thing. It's not something that will help you stand apart. So to answer your question, these are the things which will help you keep in touch with medicine when you're out of med school. However, if you guys attend that from now on, that's a good thing. I, as a medical student, also attended a lot of conferences, and and they helped me a lot. Connection and networking. You know people, then you can work with them in their projects and stuff like that. And that's where it starts from. To be honest, the important thing is to be aware of things, that you know what to do, and that you know only when you are, when you're in company of such people, when you are actively and of information, and not just information but also experience from like people who have their first hand experience with research and everything. So I hope that answers your question.
Sir, what are the tools or resources we can use for the research skills? मतलब कौन से sources हम online?
So research, when you're writing a paper, for I will start my first report, so which I think is easier comparatively. So you can go, and you saw a case which is very unique. We have a specific session on case reports. It's on my YouTube. You guys can watch that. I can share the link as well. But if you want to learn that, how to write a case report, but generally, for if you are writing a case report, there are four sections: introduction, case description, discussion, and conclusion, right? And then references. So you specifically do not need any software. I personally don't use any software to like write the references, because a case report has like 5 to 10 to 15 references, which is very less number, right? So you can manually like copy that and put that wherever. I have a I think in one of my sessions I also discussed how to reference papers. So okay. So yeah. So in that, but when you're doing like review study, I also have my YouTube on like systematic review. In that, you use Ryan software, you use like R programming, you use Stata, SPSS. You guys might have heard, that's very commonly used in our region. So SPSS, if you have a good foundation of SPSS, you can use it to your benefit, do a lot of analysis in different papers and stuff. So if you guys ask me what is something wonderful that we can do, my recommendation would be third year medical student or fourth year medical student, and you guys have, I think the best investment at this point would be for you guys to invest in one software, learn that to the core, like properly. You guys have like, for example, Obeyed, if you have time, like for example, you have 3 years in graduating, and I think the best thing you can do, apart from writing papers, the best thing you can do is get a good command of, or like R programming or Python or something like that. Because if you have that skill, it will set you apart from thousands of applicants who are applying for research positions in the future, or for anything regards to research. If you tell someone that you have a strong command of R programming or data or like Python, there are people who are doing like groundbreaking researches, like they're analyzing a lot of data from databases, and collected data, where they have to summarize and analyze that. And if you know how to play with data, if you know how to play around with numbers, and like in the world of research, you might not be the most qualified person, but you still find a very good spot in research projects. Because every research project, a good paper, I'm not talking about case report, editorial, or small papers. I'm talking about like papers, meta-analysis, like database analysis and stuff like that. There must be someone who is very good with data analysis. So one thing that you should invest your time in, I would say, data analysis. Where do you learn that from? I don't know. And I can't give you exact resources, but I am sure there are a lot of courses freely available on YouTube. And some students, some research people, they are also, I know, from RMU university, they're doing a good job, and a lot of other people, they but be mindful of that. Don't fall for the You know what I'm talking. Some courses they'll just make you pay and they won't teach you that much, but some are really good. I personally attended a few of them and they helped me a lot, even though they were not costly, like 1,000 or 2,000 rupees, week 2 week course, and I learned. So thanks to them and thanks to to the organizers for that. But do attend those courses. You attended a course, they told you about R programming, now you know some things. Okay, you didn't become an expert by getting that course for 1 week. And of course, these are things which you will be really good at. I have a junior of mine who is doing research for the last 2 3 years, and he's really good at R programming and stuff now, because he has been doing it for quite long now. And that's why I'm telling you guys, second year, third year, first year, fourth year students, if you guys have time, definitely invest it in learning about a specific R programming on top, or Python or Java. But Stata, and SPSS, you can learn SPSS really well, and you can do a lot with SPSS. And apart from that, of course, like if you ask about tools, so these are the softwares for data analysis. There are softwares for referencing, so EndNote, Zotero, and things like that we use for referencing. Then, but I don't want to talk in a language you guys won't understand. So I think it's good to start with basics, to write some case reports, some editorials where there are not a lot of references. Once you know how to write a research paper, once you know, and technically the term research paper, I'm using it generally, but it's not what you use for a case report. Research paper is something original research. Original research is you collected data from your hospital or your wherever, a specific center of, let's say, diabetes patient, about their hypertension, and then you gave a drug or something, or they are taking some drug, and then some results, you're looking at their HbA1c, you're looking at their heart attack rates or whatever, or their mortality. This is something original. Original means you created data, you collected data, you analyzed that through some softwares, SPSS, data, whatever, and you made results, and now you're writing a paper on that. This is a research paper. While other studies where you review stuff like systematic review, meta-analysis, they call it review papers. Technically, we do not call them like research paper as such. So there are different types of, and in one of my webinars, I also discussed this, what are the different types of research papers, and you can go and, you can watch that. I can share the link as well if someone needs.
Okay. Still, people do researches, audits, or teaching session. So, sir, what is the most beneficial of that? और सर कोई और ऐसे एक्टिविटी जो हम अंडर ग्रेजुएट लेवल पे कर सकते हैं
That's a good question.
तो CV.
Yeah. So I personally think, again, case report is something you guys can write. I've written like 5 to 6 to 7 or even more than that. Published, kuch hai, which I'm publishing, but they're easy to write comparatively. Another thing is letter to the editor, which we also call editorial, right? We can have a session on that as well, how to write an editorial. I can share one of ours which we published. That's a good one as well. Then I think a good thing to do would be, yeah, you mentioned audit or quality improvement project, right? So audit, quality improvement project is something which you do hospital or in your medical education. For example, you saw that in your clinical rotations in the hospital, there is a certain way that they place central venous line, or for example, ultrasound, or they're doing, like, let's say, drawing blood through a specific procedure, right? And then you thought maybe it's not the best thing. You went and you read about WHO guidelines or some specific guidelines, or how to do central venous, catheterization or something. And then you saw that there are some conflicting points. They are saying that use a specific antiseptic like chlorhexidine or something, and they're using something else. Then you're like, there is some problem here. This is not the best quality of the procedure that they're doing. Now what you do is you collect data from WHO or any specific standard guidelines which all over the world it's being followed. Then you compare your hospital's procedures or whatever with that, and then you teach people, the nurses, or let's say house officers, or training medical officers, or responsible for doing that procedure. And then you tell them, okay, so these are the guidelines and this is what we are doing, and it's not the best. They're teaching in a sense that it is a good thing. In medicine, all of us should be humble enough to know that we are not at the best level. There is always room for improvement. So it's not like a bad thing. Some hospitals don't take it well, and even some departments, they criticizing our methods or something. But no, the way you approach is, I understand we have a specific system here and we can do everything in the best way. Something could be expensive, some things are just not available on site, but you can still try to be better. So in regards to your medical practice, so clinical procedures or whatever. And then what you do is you do teaching sessions, or you make a specific module, some sessions on that, and then you collect data for the next 6 months or 1 month, and then you compare the results before your teaching and then after your teaching, and then you compare and contrast, and you tell and you write in your paper, okay, initially we did this, no antiseptic was used, and there were like out of 1,100 would get infections, but now after we took these measures, now out of 1,000 only 10 people are getting infected. So that means like we had a huge impact in our, excuse me, in our methodologies or whatever. So this is called a clinical audit or a quality improvement project. It has a really good impact. They like it a lot. Very, very, very appreciated if you do something like, because that's something very practical, right? Very practical. You're benefiting a lot of patients if you do something like that. So if you guys get the time, I think it's definitely good if you can get at least one quality improvement project in your med school. If you can do more, well and good. And the best people to approach for that, find someone who is good at research in your hospital, some assistant professor, associate professor, some professor, some faculty, and they must be doing some quality improvement or clinical audit projects. Specific they call it a clinical audit. In the US terminologies, they call it quality improvement. So then you can tell them, I'm interested in project or whatever. You can give your own idea, or you can tell them if they are doing any project, and then there'll be, yeah, we need someone to help us with writing the paper or collecting data. So you don't have to know everything about something to be able to do it. That's why research is very collaborative. You have like 10 people, 5 people, and everyone is doing their own specific line of work. There are people who have a lot of publications, they don't know how to analyze data. So some people are good at data analysis, some people are good at manuscript writing, the paper. When it comes to writing, referencing and writing and comparing and writing discussions, right? So that's also something important. You're, even if you have like very strong analysis, but your paper is not written in a very convincing way, journal would not take that, right? So you have to write it in a way that the journal likes it. So yeah, I think these are the things you can do as a medical student: case reports, letters to the editor, then quality improvement project, and review studies like systematic review and meta-analysis. These are comparatively, these are studies where you don't need to go out and collect data. You can do it from your room, in your on your computer. You have to like screen papers, take a specific topic, and how to do that, we that's a specific discussion. We can discuss that as well later on. But review studies is something you can literally do from your room. It could be a narrative review, or it could be a systematic review or umbrella review, or you, for example, it's a topic about diabetes type 1 and a specific drug used for it, and you collect all the papers on that specific topic, and you start writing and collecting data from all the papers. That's a review study. So yeah.
ओके सर. सर लोग मतलब डिफरेंट डिग्रीज करते हैं अदर देन एमबीबीएस, लाइक बीएससी, एमएस इंग्लिश, बीएस इंग्लिश, बीएस नर्सिंग. तो सर इज देयर एनी बेनिफिट ऑफ देम इन योर सीवी?
I appreciate you for bringing this question up. This is a wonderful, wonderful, wonderful question. And I think this is a much needed question. I, if I could go back, I would definitely do another degree with MBBS. By another degree, I mean
Nice
some,
one.
yeah, like
Yeah.
some, uh, like you can do something in literature. You can be a student at med school and doing English literature from another university, or Urdu literature, or Pashto literature, or a specific language, or then something in medicine, for example, biostatistics, something like public health, something like uh, administration, or something like that. And this is interesting because a lot of us, we have a very narrow image of what medicine is about. We think I'll graduate, I'll take step one, step two, or I'll take PLAB one, PLAB two, or I'll take AMC, or I'll apply for some other, or I'll take FCPS, or I'll stay here, or I'll go there, and I'll do whatever this specific person did, and that's all. While if you look at people in medicine, you would see a hell lot of variety. There are people who are doing yeah, MPH, like Tanzila mentioned in the chat. And he, I tell you what, it's, there is a specific portion in ERA CV where you can put other degrees in that, and it can help you a lot. Like for example, you're in interview and they ask you, "Oh, you did English literature with your MBBS?" That would be amazing. Like, I just did it because I like that. Simple. And you know a lot about English literature, and you, or you write poetry, or you're a writer, or you're very good at a specific thing. I would recommend, if you guys have the time, I don't know the legal aspects to that, how to do that, how to go about that. I'm not the best person for that because I personally haven't done that. If I could go back, I would definitely do that. And I wish someone had told me that and someone had stressed on it. And this is something students should be made aware of, because our overview is very narrow. We just, at MBBS, you guys know that. Some people in fourth final year, you will know that there is a lot of time. There is a lot of time you can spare. The medicine that we study in 5 years, you can literally do that in 2 to 3 years. It's like, I understand exams are difficult and everything, but if you think about it, nobody's studying every day, and like, we just study for 2, 3, 4 months and that's all. We are not like, so we can do research, we can do some other degree, learn something new, a specific skill which you can talk about in your interview. And whenever you're applying for training like abroad, they look at your CV as a whole, like a very holistic overview. It's not like I scored the highest on my step one or step two or step three or whatever exam and I have 100 publications. They don't care, to be honest. And if you have decent score with a very decent personality and very good communication skills, they'll place you really well in a very good position, and you'll be able to enter good training. So I think yes, definitely. And of course, like I would stress on it particularly. I know people who did PhD with their internal medicine residencies, PhD with the, and then people who did like masters along with their residency. And then uh, recently I met like a program director at a specific institution where he is doing like business administration, masters in business administration from Harvard University, along with his leadership role in the program. So, and then there are different posts for that. You enter like organizations like WHO, like UN, and a lot of they have doctors. So you can be in corporate, you can be in sports, you can be in good organizations, and they have really good privileges and really good uh, compensation and everything. So if you guys can do something like that, specifically people who are interested in business and have good business skills or have a background in business, I would recommend, if you can do BBA or then later on, let's say MBA. Oh yeah, and don't quote me on this. Don't go and do business and then screw up your MBBS or something. I'm not like advocating for that, but what I mean to say is, if you have the time and you can do it, yes, by all means, MBBS should not limit you from pursuing your, if someone wants to do business, medicine has a lot of business opportunities. As a doctor, there are a lot of businessmen you'll see, you'll be amazed of. There are a lot of people I personally know who are so, and someone could be interested in public health, someone could be interested in a specific thing which is very different from the conventional pathway in cardiology and gastro or whatever, right? So yeah, if someone is interested in literature, right? So yeah, of course, I'm glad you mentioned that.
Okay, sir. Sir, let's say someone do three researches, but they are of high quality and they are published, and some other do we can say the junk researches, matlab, which is not much important. So, sir, and they are a lot, मतलब the junk research are a lot. Sir, इनमें कोई difference है कि
Yeah.
तीन? Yes, sir.
Again, really good question. I have to appreciate the quality of questions you're asking, and I think these are very different and something needed, right? So I think quality over quantity, of course, and this is very a niche statement that we usually hear, which is true, which is
Yes,
basic, but at the same time, I personally think at times quantity can benefit you as well, right? So okay, and this is something interesting. So I don't know if anybody here knows about EB2 pathway, national interest waiver, to be able to get green card in the United States or other countries. Researchers, if you have good research, quality research, research can take you on top of the world in medicine. Like it can literally, up your game by you will be you can be on very good positions. For example, a lot of people from other countries, which I won't name, but our people from Pakistan, they don't know this. A lot of people don't know this, and a lot of people are just they don't think they are capable enough of doing that. But there are really good opportunities that you can take when you are good in research. One of the examples I can tell you is, and a lot of people do it and they don't share this, or they don't help other people with that. So if you search EB2 pathway, search it and you'll know what it is. There are groups on it, there are videos on it, courses, I mean like guidance there. They hire lawyers for that here in the US. So EB2, I'll give you a very because this is interesting, and I would want, if someone later on does this, do let me know, and I'll congratulate you on that, and that would be a very happy moment for me. But EB2 pathway is, so there are different pathways to get green card in the US: EB1, EB2, EB3, EB4, and these are specific routes, right? You did something like business, and some people research, some. So in one of the pathways, EB2, there is something where you have to be on a specific job. For example, in residency, they give either H1 or J1 visa, right? You guys should know. T1 is what you get for your clinical rotation visit. If you want to do research, you'll get J1 research visa, scholar visa. And for residency, you get J1 clinical visa or H1B visa. In J1 visa, you have to, after you do residency, you have to do a 3-year waiver job. Waiver job means you have to work in some periphery in the US, or you have to come back to Pakistan. This is normal J1 visa. And once you do your waiver job in some periphery, then you can apply, then you get H1 visa. Basically, what happens is you do residency on J1, and then your waiver is actually H1 visa, because that H1 is basically a work visa, which is a dual intent. Dual intent means immigrant plus non-immigrant, right? So some people with H1, they end up getting green card and you stay in the US. Some people go back, right? So that's a dual intent. J1 is non-immigrant visa. B1 is non-immigrant visa, visit visa, right? So you don't intend to do immigration. You just are going to the US for residency, and then they expect you to come back to Pakistan for 3 years, and then you can apply for new visas in the US. Or you have to, if you want to stay in the US, you have to work in periphery, and then your employer, for example, XYZ hospital, you did residency, and now you're going to ABC hospital. The employer of the hospital, they sponsor you an H1 visa. Now you are actually thinking of immigration. You're doing your 3-year waiver job, and then after that you fulfill specific, because now you have completed the waiver job, the waiver 3-year waiver. Now you can apply for green card, and then in about 1 to 2 years you get your green card. That's the normal usual route for J1. For H1, if you start your residency on H1B visa, that is a dual intent visa. In H1B, you're not obligated to do a 3-year of waiver, right? So you do your 3-year residency in the US on H1B, and then the moment you are free from your residency, you get a job in ABC hospital. The employer sponsors your green card because they tell the consulate that this is a person, this specific person I need in my hospital, and I want him or her to stay, and you guys should give them green card. So then it takes like a year or two or something like that to get green card. So to summarize, J1, you need like 3-year residency plus 3-year waiver plus around 2 year of your, waiting for green card. That's about 8 years. H1 is 3-year residency plus 2 year to get green card, roughly speaking. Don't quote me on this, but roughly speaking. So H1, if you're on H1 visa, since you're not obligated to do your waiver job, 3-year waiver, you're actually eligible to apply for green card anytime. And now you can pursue any of the EB 1, 2, 3, 4, whatever pathway, right? So one of them is business. You have money, you're investing, or with a specific business, whatever company. I don't know the specifics. You can search that. EB2 is your employer giving you, sponsoring your green card. Like I said, you're working on a job and then they sponsor. This is very off topic. I'm very sorry, but I think this is good to learn.
Yes.
And then, so one is either your employer sponsors you a green card, or if you're an exceptional person, if you're like a researcher, did postdoctoral research or did some PhD, and you have other degrees, MBBS, MD, ECFMG certificate, you did research, you have a lot. So now, okay, I'll come to your question at the end, and then you'll understand why I'm talking about all this. So in that case, you're working in the national interest of the US. You're benefiting the country in some way. You're doing research in software engineering, arts, or medicine, or pharmacy, or something like that. For us, it would be medicine, of course, and they hold medicine in high regard everywhere. Medicine is held in very high regard. Then you apply. Even if you don't have a job offer, you can still apply. Even if you're in residency, you're doing training, you're not on a job or something, right? Your employer is not sponsoring your green card. You can apply for it by your own self, right? By yourself, independently of anything. You're on H1, you're doing your training, but you have a lot of citations in research, you have some degree, you have a specific, you have a high significance in your field. You can apply for called national interest waiver. National interest waiver, what does that mean? It's your need to get a job is waived, right? So national interest waiver, so you're working in the national interest of US, and they will say, okay, you're a very important person for us, we'll give you a green card regardless of whether or not you have a job offer. That's called EB2 pathway, national interest waiver, to get a green card. And people are doing this, but not a lot. a lot of people who actually can do this. You as students, if you guys really, work on your research profile from now on, and build up your, for that you need some specific number of publications, citations on. So do you know what citation is? Citation is when you have a paper and someone else cites in their research, your paper in their research, that's like one citation for you, right?
Reference, like you.
So if someone cites your paper one time, that's one citation, twice, two citations, three citations. And normally, to be eligible for the EB2 pathway, national interest waiver, you need to have a good research profile. And a good research profile is not only publications, it's also citations, right? So you have to have like 30, 50, 100 citations. And you can get that if you work from now on. And so basically, a case report or editorial or letter to editor or a very simple paper, I would not say any research is a bad research. Everything you do is important and has significance. It will help you in residency fellowship. But if you're asking me about these things, how to stand out, like in these specific things in research position or getting a specific thing out of it, then you have to have quality paper which can get citations. Which, so if there is a trial published in New England Journal of Medicine or Lancet or Nature or big journals, in the next 1 year it will have 100 and 500 citations. That's what a quality paper is. So if you get your name into a quality paper, which would be a randomized controlled trial or a meta-analysis, but very strong, or usually meta-analysis also. So that's why they say, what is the impact factor of the journal? For example, you're sending a paper to XYZ journal and you're publishing in it. Every journal has the metrics and they write impact factor and side score, right? Side score. So impact factor is कि एक साल में exact definition आप देख लें, but generally if I roughly explain it, side score and impact factor, roughly इसका idea ये बना लें. If a journal has like 5 impact factor, इसका मतलब है कि आपके पेपर पे एक साल के अंदर अंदर 5 citations की chances हैं कि उस पे 5 citations आ जाएं. You got it? So if you have like 10 papers in let's say impact factor, which is like 2 or 3 journals, and 10 papers, you can expect कि आप 1-2 साल में 20, 30, 40 citations gain कर लें. ठीक है? So if you get a specific number of citation, and the higher the better. If you have like 100 citations with 30, 40, 50 publications with some PhD or MPH or some degree along with your medicine degree, ECFMG certification, being a resident in the US or training or something, you can apply for your EB2 national interest waiver. And for that, some people hire a lawyer to do that. Some people apply like independently, but it is a wonderful opportunity, right? And then there are, of course, there, if you go to the UK website and you search for visa types, there are visas for research, right? Specific visa where you have like a specific job offer in some research institution or a lab, and you get not visit visa, nothing. You get a research, and it has very low rates of rejection, and it's almost understood that you will get it, right? So that I would like you guys to do your further research on it and let me know if you find something new or something interesting. But I would want you guys to, if someone has, you guys have that, you have the potential, get your name in good research. Of course, do research is like 10, 25, whatever publications in your med school. But later on, when you're in the US or you're applying for research position, some people are getting research electives at Johns Hopkins. A lot of my juniors, I can connect you guys with over that as well. Go to Johns Hopkins and email the preceptors about your interest in working with them on research elective. Go there for a month or two. Usually they are 6 to 8 weeks, 4 weeks, 6 weeks, 8 weeks, and then you go there, you work with them on some project, some small project. It's either your idea or their own project going on, and you help them. But that could be a very good opportunity to get a research position in the same university, same hospital, right? You can talk to other people you're interested, and for that, that's where your skills will come in. I know R programming, I know SPSS, I have like 5 papers, and I presented in these conferences, I presented in ACP. And when they hear your interest plus your skills, there is a 90% chance that you'll get like some position research, paid or unpaid. Then you can discuss, we can talk about that as well. What is a paid position, what is unpaid position, which visa do you get for that, J1 waiver with 212 rule and everything. So that we can talk about as well. But I would encourage you to learn about this. I'm here to explain that whenever you guys need some info. But to be honest, I'm also in the learning phase, but I can definitely push you towards something and then you guys can do your own research. But I definitely highly encourage. So that's where now you ask, if you have 100 case reports, I doubt you'll get ever like 10, 20, 30 citations on them. But if you have one paper, which is a randomized controlled trial, did with some high profile people, you're definitely looking at 20, 30 citations in within a year, right? And then you are eligible for these things, you can apply for them. So yeah, I hope
Okay, sir.
that was something fruitful to learn.
Yes, sir. Sir, we heard a lot that the researches that is done in Pakistan or that are published in Pakistani journals. So, sir, they are not much beneficial, are they?
Yeah, so
Huh?
I yes and no. Why? Because again, you look at the impact factor. If there is a Pakistani journal which has a very good impact factor, that's a good journal. So basically, for research, try to publish your paper in journal which is PubMed indexed. What do I mean by that? So you publish in a journal, Ayub Medical College Journal, Khyber Medical College Journal, Sedu Medical College Journal, Journal of Pakistan Medical and Health Sciences, or whatever. And then let's say Journal of American College of Physicians, Journal of Clinical Oncology in the US, or European Journal of Internal Medicine. Um, so you look at whenever you are looking at that journal metrics and look at the impact factor, and then also look at whether or not the journal is PubMed indexed. What do I mean by that? PubMed and Scopus and Embase and Google Scholars, these are databases, right? So when you publish a paper in a specific journal, database जो होती हैं, database जो होते हैं, for example PubMed हो गया, Google Scholar हो गया, उस पे papers आते हैं एक specific topic पे, जो कि जर्नल में पब्लिश हुई होती है वो पेपर, राइट? सो डेटाबेस इज लाइक, फॉर एग्जांपल मैं इसको किस तरह एक्सप्लेन करूं, लेट्स से यू हैव सीट्स इन केएमसी, एनएमसी, एसएमसी, और केएमयू की वेबसाइट पे वो सारी सीट्स हैं कि इतने सीट्स फाड़ा के हैं, इतने सीट इसके हैं. So that's like the database is KMU, but all these other KMC, KMU, AMU, whatever other colleges, they are the जर्नल्स. तो अगर आपका पेपर एक ऐसे जर्नल में पब्लिश होता है विच इज पबमेड इंडेक्स्ड, तो आपका पेपर उस जर्नल के थ्रू पबमेड पे इंडेक्स हो जाता है, उस पे शो होता है. एंड अ लॉट ऑफ पीपल व्हेन दे आर साइटिंग पेपर्स in their research, they look at PubMed. So if your paper is published in a journal which is indexed in PubMed, it has a high chance of getting cited in the next 1 year or two, right? So by saying a good or bad journal, there is nothing like Pakistani research or USA research or UK research. You did a research paper. I can show you people in Pakistan who have outstanding research profiles, and they are published in Nature and New England Journal, and they're in Lancet and things like that. You can be here working with professors or faculty or supervisors in big universities, and you can publish your papers. And we personally, like, we wrote papers, case reports and stuff, and we published them in good journals, US and Europe and stuff like that. So it's not necessary that if you're sitting here, your papers will go into Pakistani. No, 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 that's not. If your paper, any journal would be happy to take it, right? So you just have to prepare your paper according to the journal. There, whenever you're publishing, whenever you have a paper, you can go to Elsevier, Science Direct, there is a specific portion for journal finder. You can put the abstract in it. It will show you journals where you can send your paper. Sometimes you can ask your seniors, where do you guys publish your case reports or something, and you send your, and it's important to go and read the for authors section in the journal. Right? They'll tell you what kind of paper we like, and you can look at the journal's recent publications, and then you can see if your paper aligns with that or not, right?
Sir, as you said that we have to prefer the PubMed index journal. So is that same for the Google Scholar?
So basically, PubMed is here, Google Scholar is here, right? So if a journal is indexed in PubMed, I would say 99.99% chances it is indexed in Google Scholar as well. But if a journal is indexed in Google Scholar, there are chances it will not be PubMed indexed. So I have a few papers in journals which are Google Scholar indexed but not PubMed indexed, right? For example, Journal of Sedu Medical College, and I think a U Medical College journal is PubMed indexed, which is good if you guys. But honestly speaking, from at this level, your concern should not be PubMed, Google Scholar. If you can, definitely then go for it. But if you just want to get in the world of research, setting your feet in that region, I would say go for anything. As long as your paper is available on through whatever thing, go for it.
Ubaid, allow me if I can ask a question. Uh,
Yeah, you can. Sir, you can.
sir, as you know, we have a lot of workshops here and seminars here in KP Medical Colleges these days, and each one of them are offering certificates. So my question is, which type of certificates are having more value regarding our CV? I mean, whether the interviews they count every certification that we have, or they count only the certifications that have a sign of specific authority, or something like of
Good,
higher value.
good. Okay, so thank you, Arshad. Ubaid, what do you think about this?
Sir, yeah, I agree with him that it depends on the organization that whom is uh, giving us the certificate. Sir, yeah, it depends on the organization.
Okay,
I mean, anything we can do at this level is we only get a certificate, and we don't know whether it's of a high value for us in the CV to help us, uh, or it's a useless thing. I don't know. I have many certificates, and I don't think it will help me in my interviews, or it will strengthen my CV.
yeah, that's the question. That should be the question. So basically, no, ERAS application will never ask you for a certificate, right? Never, ever, ever will it. The only certificate it will ask you for is ECFMG certificate, which you get with step 1, 2, and occupational English test and apply through a specific pathway to get ECFMG certified, which is necessary to get into residency. Other than that, if I tell you about mine, it's the same. I have like hundreds of certificates, but that's not, you attended an online course, it gave you a certificate, and then you're being getting happy, oh, I got certified by. No, it's not how it works. At the end of the day, what you upload in your ERA CV is your publications, your poster presentations, your oral presentations, your experiences. Experiences could be a course that you attended, a volunteer experience. For example, you went to Africa and did some camp over there, and that's a huge volunteer experience. Or you went to uh, a specific village in Pakistan, or you did something like, anything in volunteer work, you did some financial assistance thing for someone, or but it should be something good and something valuable, and then you can put it in our CV. Then it could be community work like blood donation, blood society,
Mm.
or it could be clinical experience in the US, like you did a 1 month elective or research elective or clinical elective, or a postdoctoral position in some university in the US on research or something, or clinical or whatever. These are the things, and the maximum you can put is 10 experiences. You can only put 10 experiences on your ERA CV, right, at this stage. Later on it could change, go up or low. अभी तक ये होता था कि people would upload their CVs. Now you have to put in data in the ERAS application and then it makes a CV at the end. So you can only add 10 experiences. And in 10 experiences, one of them could be with a specific research committee. Another one could be you doing a research elective in the US. Another one could be, I don't know why it's showing balloons and thumbs up, but I think it's responding to my gestures. But uh, generally speaking, you'll add like maximum of 10 experiences in your era CV, and it could be diverse, it could be research, and it should be diverse. One or two should be from research, two three should be from clinical experience, a few should be from volunteer. So the 10 experience, and one of them could be a hobby, like you doing football or you doing hockey or you doing cricket, and you went to whatever college team and you did some, got some prize or had good experience or anything. So it could be book reading, it could be writing, it could be anything, right? So certificates आप कहाँ कहीं पे भी नहीं डालते. Whatever you're learning, if for example this session we make it like a certificate and then we tell you pay 100 rupees and at the end you'll get a certificate, it's useless, right? Whatever you learn and you apply that, that's important. Certificate apne saath gather. And that's why there are people, when we would do a session or do some project at Khyber or did any, a lot of people would ask me, we need certificates for the activity. Then I would know that they don't know how the system works. No one asks you for certificate. Just chill, man. Like, you attended the course, don't worry about certificate. Put it on your era CV if it's something significant, and talk about that in your interview. You should be able to justify that. What did you do when you did a specific course? Okay, you did a course with Johns Hopkins on Coursera, which was 1 day, and I doubt if you even attended the course or sat there for 4 or 5 hours. And then you got a certificate, and now you're putting like you got a certificate from Johns Hopkins. No, you didn't. It was just an online course and you learned two, three things. How are you applying that in real life, in research? Did you write a paper and apply your Stata or R programming skills, your SPSS skills, or no, you just wanted to put it on your LinkedIn or you just wanted to put it somewhere? No, right? So any experience is valuable, but don't chase certificates. You can have 100 or 500 or 1,000 certificates. The only certification you should be going after is ECFMG certificate, any other degree, MPH, MBA, BBA, or biostatistics course, or something which is valuable, like a 6 months course, a 1 month course. The rest of them, like online 1 week course on meta-analysis, definitely attend that, learn how to do it, and then apply and write a paper or two, instead of like going after 1 day course to Lahore and then 2 day course to Karachi and then wasting your money and time and everything. No, that's not
So,
valuable.
sir, let's say if someone mention that in his about TV ना, तो सर क्या पे वो चेक होता है, मतलब उस पर कोई सुपरविजन
Okay.
होता है?
That's a good question. That's a good question. And I definitely, everybody is thinking, and it's just that some people ask, some people don't ask. No, no, and yes.
तो सर
Again,
is it not unfair?
if you tell me you had a 1 month research elective at Johns Hopkins,
Yes, sir.
I can know that in 2 questions. I'll ask you 2 questions, 3 questions, and I'll be able to know if you really went there. So I would say, if you don't have an experience, it is better to have 9 experiences on eras and miss one, instead of writing 10 and you didn't do one of them. You can actually lose your position because of that one thing that you mentioned which was not true if they find out. And now it is a question, when do you get caught? That's the question. And it could be any. For example, you cheated on an exam, or let's say you had a specific certification that was bogus, that was not something original work, or you put your name. That's another thing. A lot of people nowadays, they are getting publications. Oh, so this is a specific research group, give me $100, I'll give you third or fifth
Yeah.
place. That is bullshit. That's a very that's something ridiculous that you would do. Why? Because as a program director, They're asking you question. Okay, now on to your publications. So I can see this one research in your era CV. Could you please explain this to me and what this project was about? And you stumbled somewhere, or you didn't know what you did, and that would be a disaster for you. Like you did all the things, exams, and then 4 or 5 years of hard work, and at the end you got caught somewhere, and now you're in trouble now. So I would highly discourage from mentioning something on your you didn't do something, that's fine. You're not you're going to a training, right? So for a training you need to be someone who doesn't know everything. If you know everything, I know I have cardiology medal and I have pulmonology medal and I have 100% score on my, why are you coming to training? So if you are coming to training, of course you'll have deficiencies. Just make sure you do the bare minimum. Have good communication skills, good interview skills. When you're talking your language, they should understand what you're talking about. It should make sense. Your CV should make sense. It shouldn't be like, I did one research in Peshawar, then another one in Karachi, and then the next day I was in Lahore, and next day I was in Los Angeles, and the next day I was in Europe. How did you do that? Did you have like, do you have some superpower that you did that? No. So don't have like weird experiences on your CV that doesn't make sense, right? Everything should be, if something is your original work, yes, mention it and talk about that. So this is another thing. Usually यहाँ पे हमारे लोगों में मसला क्या है कि for example, the other days we were discussing this, and one of our seniors mentioned this. One of their mentors were telling them, for example, आप गए, आपके पास एक दोस्त आया है, you have a friend, and then there is a glass on the table, and your friend wants water, and you went there and you got the glass for your friend and you gave him or her water and they drank. ठीक है? तो इसको प्रेजेंट करने के दो तरीके हैं. एक तरीका ये कि so yeah, my friend was here and he needed water, I gave him water. एक और तरीका है कि I had a friend and he was this person and we were sitting in there. It was hot summer and where everybody has like dehydration, and he was in severe need of water. And then I was there. I saw something, an opportunity to do something for benefit of people. And then I went there. I grabbed the glass. I filled it with water. I pulled ice in it, and I made sure that it's something nice and something refreshing. And then I presented it to him, and it was refreshing for him. This is another way to present it. So a lot of other people, we do significant work, but we presented the first example that I gave. हम लिखते हैं कि बस I had a research elective here and that's all. आपने एक लैब में काम किया in Peshawar, in wherever, उसको बढ़ा चढ़ा के present करें. Present it in a way कि oh my god, you worked in this lab and it was biotechnology, and oh, now artificial intelligence. Of course everybody exaggerates thing, and it is just about how you sell your thing. That's, everybody is selling something. Someone is selling their scores, someone is selling their research, someone is selling their whatever, their communication skills. It's about how you present it, how you talk about that. एक ये कि I went to this lab. Yes, I would go in summer vacation and it was a good experience. Another one is summer vacation. It's just 1 month in like very busy schedule, and I made sure I go there every day on time and spend extra time, talk to people, learn courses, make sure to do कोई publication कुछ भी नहीं की. No, it doesn't matter. Even though I couldn't write a paper, I made sure I make there on time. I learned something. I had skills. I learned about the software. I learned about these specific graphics, and present it in a way that it tells, oh yeah, this person is interested to learn, right? So the way you present it is different. Don't we have significant experiences, but the way you present it, it makes a hell lot of difference. So you don't need to lie about something. Just whatever you have, mention it in a very, very, very attractive and convincing manner, right? And I think that will do wonders for you.
सर मैं ये पैसो वाले रिसर्चेज जरा पॉइंट आउट करना चाहूँगा सर. सर दे हैड पब्लिकेशन एंड सर वो पब्लिश भी हो जाते हैं और उनका मतलब साइटेशंस भी आ जाती हैं. पर सर वो वही पैसों वाले होते हैं, जैसे आपने कहा। तो सर ये तो वही हो गया, बोगस काम हो गया। तो सर बेनिफिट
लेकिन
कैसे
रिसर्च
लो?
तो है, सीवी पे तो आ जाता है, तो क्यों ना।
यही सर, यही बात है ना सर, यही बात है कि रिसर्च तो है।
So for example, I ask you, do you have any publication? No, I don't, but I'm very interested and I'm learning. I did this online course on meta-analysis, and currently I'm writing a case report with one of my preceptors at this hospital. And I'm very interested and I would want to learn. And in residency, this is one of my biggest goals, that I learn how to write case reports, and I will publish a few. And I'm talking to a few seniors, and I'm attending this course, and I already attended these. Okay. Another one is, yes, I have publications. I have 5 publications. Okay, which number author are you on? Fifth, and in one of them I'm on eighth, and in one of them I'm on second. Okay, so could you please tell me about this specific project? And then you're not able to justify it, even though you justified it. Okay, the point is, चल जाता है, कभी कभी चल जाता है, कभी नहीं चलता, and you don't want to. It's 50-50. It can go either way. Why would you want to jeopardize your whole? आप अपने पूरे application को खतरे में क्यों डाल रहे हैं? Why not do nothing and talk about that in a way which is convincing? Simple. Tell them, okay, in Pakistan, you didn't get a chance. No one tells you about research in your med school. No, we have a system where even though we had good ideas, we couldn't execute them. And that's why I want to come to the US. I want to do some quality research, some quality projects. I have these ideas. कुछ आइडियाज बना लें, कुछ अपने जहन में बना लें, कुछ चीज़ों पे काम शुरू कर दें एंड जस्ट मेंशन. आई टोल्ड यू, यू कैन मेंशन पेपर्स व्हिच आर नॉट पब्लिश्ड येट. सो आपने कोई पेपर लिखा, वो पब्लिश नहीं हुआ, डजेंट मैटर. आप उसको कहीं पे अनपब्लिश्ड में डाल दें, कुछ ना कुछ वहां पे लिख दें और इंटरव्यू में उसको फिर जस्टिफाई करें. इट्स नॉट अ गुड जस्टिफिकेशन कि हमारे मेडिकल कॉलेज में भाई रिसर्च का कुछ. नाउअडेज हर एक बंदे को पता चल रहा है, यू गाइस आर लर्निंग, बट इट्स, एक्सक्यूज मी, इट्स नॉट नेसेसरी कि आप एबल होंगे कि आप 10 पब्लिकेशंस करें. अभी अभी रिसेंटली हमारे लास्ट इस साल लोग मैच हुए हैं, उनके सीवी पे कुछ नहीं था रिसर्च का, एंड इट्स फाइन, पीपल गेट मैच्ड. बट आई टोल्ड यू, इफ यू हैव डन समथिंग, मेंशन इट एंड टेक बेनिफिट फॉर दैट, गेट क्रेडिट फॉर दैट. बट डोंट डू एनीथिंग लाइक पैसों पे उसको पैसे 50,000, 20,000, 10,000 दे दिए, पेपर में नाम तो आ गया, बट व्हाट आर यू डूइंग इट फॉर? जस्ट टू fill a space in there? No, you don't need that. It's not necessary, right? कोई चीज जरूरी नहीं है, तो क्यों आप कहीं ना कहीं जाके, उसने प्लेजरिज्म किया, उस बंदे ने अपने पेपर में बोगस पेपर उसने लिखा, आपने अपना नाम उसमें डाल दिया, उस पेपर पे मसला. There are journals where people publish their papers and later on they find that the work was not original. They retract the paper as well as blacklist all the authors. No, you cannot publish in that journal anymore. So you don't know unless you are sure. Okay, कभी कभी, अभी ये मैं बता देता हूँ, कभी कभी आप रिसर्च कर रहे हैं, आपका एक ग्रुप है, 3-4 लोग हैं, अभी आपने पेपर्स लिखना शुरू किए, एक केस रिपोर्ट आप लिख रहे हैं, एक मैं लिख रहा हूँ, एक वो लिख रहा है. तो हमारी गपशप है आपस में, थोड़ा काम मैंने उसमें किया, थोड़ा मैंने कुछ भी काम नहीं किया, चलो थोड़ी बात शायद कर दी, एब्स्ट्रैक्ट लिख लिया 2-3 मिनट, कुछ एक पैराग्राफ लिख दिया. आप मेरा नाम अपने पेपर में डालते हैं, मैं आपका नाम अपने पेपर में डालता हूँ, वो हम तीनों पेपर्स में आ जाते हैं. यू आर वर्किंग ऑन वन, बट थोड़ा बहुत इधर उधर काम करके, एंड ये हर एक कर रहा है, कोई कहता नहीं कहता, बट हर एक ये काम कर रहा है. दैट इज फाइन, दैट इज फाइन, बिकॉज आपके आपके अपने सर्किल है, आपको पता है भाई प्रॉपर वर्क है, हमने आपको पता है उस केस के बारे में. कल को अगर कोई आपसे पूछता है कि भाई ये रीनल सेल कार्सिनोमा विद व्हाटएवर आपका केस, हाँ आई नो दिस वाज इन वन ऑफ आवर हॉस्पिटल्स, ये हॉस्पिटल था, ये पेशेंट था, इतनी एज थी, मुझे याद है सब कुछ, राइट? सो एट लीस्ट यू कैन जस्टिफाई इट. और आप वही ना छिप ऊंचा तो स्तर गए है ना.
Yes, sir.
No, you want to be you want to mention something with confidence. आपने
Yes, sir.
वो थोड़ा बहुत वो सारा एप्लीकेशन का मजा खत्म हो जाता है ना, उसमें थोड़ी भी एक चीज इधर उधर की ना, आपको खुद यू आर नॉट हैप्पी विद दैट. सो if you are not satisfied with your own application, don't take it forward and
Yes, sir.
talk. It might hurt you, and you
Yes.
don't want to hurt in the process. So it's fine. You didn't do something well. That's fine. No problem. You can do that. That's why we train. That's why we go abroad. We learn, and it's not like अफलातून हर एक बन जाए तो then why are we doing फिर तो सीधा भाई patience treat करो ना. Why are you doing training then? तो everyone has to learn something. Deficiencies हर एक में होती है, and it's fine. That's not.
Sir, I have last few questions. Sir, is there any, this is a baby question. Sir, is there any special space for the elective in the CV that we do? Or it's just mentioned under the experience section?
Yeah, it's mentioned in experience. Plus, you need at least 3 or 4 letters of recommendation, and wherever you do your elective, the preceptor or the supervisor writes you a letter of recommendation, and then you can apply, you can upload it as a letter of recommendation. तो आप अगर एक elective या observership या कोई externship internship करते हैं, उससे आपको जो letter मिलता है, you can upload that as a letter of to support your application. So, and of course नहीं कुछ नहीं क्या है.
Okay, sir. सर लास्ट क्वेश्चन क्योंकि टाइम बहुत ज़्यादा हो गया, तो सर बेसिक क्वेश्चन है बहुत ज़्यादा कि मतलब जो यूएसएमएलई प्रिपरेशन कर रहे हैं स्पेशली अपनी क्लिनिकल ईयर्स में, तो सर वो अपने पब्लिकेशंस या रिसर्च के लिए कैसे टाइम निकालें? मतलब दे डोंट हैव मच टाइम फॉर दैट एंड सर
this is difficult. It is difficult, and I know it's research easily नहीं होती. आप एक केस रिपोर्ट आप लिखते हैं. It took me 2 years or 3 years to publish पहला केस रिपोर्ट, and it's difficult. You guys can do it in a month probably. आपको कोई सपोर्ट करे, कोई सीनियर थोड़ी हेल्प कर दे, या आप खुद थोड़े depends. But I personally start early. If you start like very early, then that's the bonus point. First year, second year में आपने third year में start किया. I personally started in final year after my step 2 exam. But if you start early, मैंने इसलिए ये बात की to encourage you guys, because if someone is from final year, it's not like you're already बस बात खत्म ना. No. A lot of people start their step exam journey after their house job. आप तो आपको पता है आप step 1 दे रहे हैं, दे चुके हैं, whatever step 2 दें. You're on a very good track. साइड पे थोड़ा सा टाइम निकालें. Okay, usually इतना मैं सजेस्ट करूंगा कि रोजाना 1-2 घंटे रिसर्च को दें. किस तरह दें? कोई सॉफ्टवेयर सीखें, कुछ लिखें, write anything about any topic, and then read a paper and then write it in your own words and then change it around. कोई केस मिला आपको, उस केस पे डिस्कशन लिखें उस पे, और सीखते रहें, रीड करते रहें. अच्छे जर्नल्स के पेपर रीड करें, अच्छे जर्नल्स के पेपर्स. Annals of Internal Medicine, I highly recommend it. It's American College of Physician का जर्नल है, Annals of Internal Medicine. उसके साथ स्टूडेंट मेंबरशिप लें. स्टूडेंट मेंबरशिप फ्री है. I have like 55 or 60 people in here. Everyone should be a student member of ACP. It's अपने आप पे इसको फर्ज कर दें. आपको ईमेल्स आएंगी, वो आपको केसेस भेजते हैं, आपको पेपर्स भेजते हैं ईमेल पे, आप उसको रीड करें, उससे आप आइडिया लें. A lot of people they would ask के रिसर्च का आइडिया कहाँ से लें. This is where you got the idea, right? तो I forgot आपको.
सर एक लास्ट क्वेश्चन मैं करूंगा क्योंकि टाइम बहुत ज़्यादा हो गया. सर ये MHP बहुत ज़्यादा लोग करते हैं MBBS के साथ, तो सर इसके कुछ बेनिफिट्स क्या हो सकते हैं?
So it's basically MPH, Master in Public Health, and I think you're talking about that. So अगर आपने कर ली, that's good. I think, I'm not sure, since it's masters, I think you'll have to do it after your bachelor's in medicine and surgery, MBBS के बाद. But there could be some bachelors in that or anything, I don't know personally, but if you can do it, then MPH का फ़ायदा ये होता है कि अगर आप WHO, UN और इन जगहों पे काम करना चाहते हैं, तो उसके लिए आपके पास MPH होना चाहिए. पब्लिक हेल्थ के सेक्टर में अगर आप कोई काम करते हैं, तो वहाँ से आपको थोड़ा सा आपको if you have that degree तो आपको easily वो मिल जाएगा. And Muhammad is asking its annals of internal medicine.
Yeah.
और इसके अलावा आपने I think मोहम्मद ने he asked about. So there are a lot of questions. I would want, Ubaid, if you can at least just copy or get screenshots of the chat. I would like to see them
Okay.
later and discuss
Okay.
these.
Yes, sir. I
in
will
some-
get it.
Yeah. So yeah.
I think, sir,
Okay.
it's enough.
One sec. Sorry to disturb. वो लोग जिन्होंने बाद में ज्वाइन किया, I would encourage you guys to watch like I think 20-30 minutes में जो हमने डिस्कशन की EB2 पाथवे पे और ये सारी चीजें, वो ग्रीन कार्ड और वो सारा, तो वो देखें. It might be of help. It might be a kickstart to something different for you guys. Something very good in your career. So I would encourage you आप लोग to watch that.
सर बस अभी टाइम बहुत हो गया, एंड करना है. और सर अगर एनी टेक अवे मैसेज फॉर द ऑडियंस, एनी सर, एनी जर्नल और अपार्ट फ्रॉम स्टडी सर, इफ यू कैन.
Yeah, I appreciate. One thing I would say, I appreciate you guys. I personally tried to do a lot, but one second. अच्छा, I'm back. I'm sorry. So, आपने क्या बात पूछी थी?
सर एनी टेक अवे मैसेज.
Yeah. Before takeaway, I would like to सिर्फ एक थोड़ी सी एक मैं बात. Someone asked about I write a lot, but I don't know how to mention it on Eras. So I would suggest, if you're a writer and you write like blogs or poetry or anything, talk about it in your personal statement. अपनी personal statement writing के बारे में करें, उसको उस पे लिखें how you are interested in that. I personally know a senior who is a writer as well, and he had a wonderful personal statement, and it was discussed in his interviews, and he had very good feedback from the people who interviewed him, because उसने सारी बातें writing पे की थी और थोड़ा सा तो कहीं ना कहीं आप उसको फिट कर सकते हैं. एरा सीवी पे एक्सपीरियंसेस में डाल सकते हैं, पर्सनल स्टेटमेंट में डाल सकते हैं, कहीं ना कहीं जो है आप उसको मेंशन कर लें. और वॉलंटियर, हाउ डू यू मेंशन दोज वॉलंटियर एक्टिविटीज इफ नॉट फॉर सर्टिफिकेशन? अगेन, सर्टिफिकेशन आपसे कोई नहीं लेता. नो वन आस्क्स यू अबाउट सर्टिफिकेशन. आपने एक एक्सपीरियंस किया, दैट्स व्हाई आई से आपने कहीं पे काम किया, डोंट आस्क अबाउट सर्टिफिकेट. गो एंड डू दैट एंड गो बैक होम. उसको आप एरा सीवी में लिखें, मैंने ये किया था, इस जगह पे किया था, इतने टाइम के लिए किया था, 1 महीना था या 1 वीक था, और थैंक यू, तो 1 वीक के लिए था, और इट वाज दिस एक्टिविटी एंड दिस इज व्हाट आई लर्न. No one would ask you certificate. आप उसका certificate आप खुद हैं. If you are talking about that in interview, they will know. They have, हम उनके बच्चे हैं, they're like, they have 50 years of experience, and they know okay कहाँ पे, if someone did something, they'll know, they'll figure it out. As a take home message, I would say कि learn new things, and don't, if you can take one advice, I would suggest don't have a notion of whatever career you're in, and don't think like horse jo hoti hai, it has like I would do horse riding. Basit would know that as well. He was with me, and we would be in a team, and we would do horse riding. तो घोड़े के यहाँ पे आंखें छुपाने के लिए there you know what I'm talking about. So it has something in there where they can't see here and there. So we are the same. We look at a conventional pathway, and we look at a specific person or a specific whatever, and we try to follow the exact thing that that person did. It could be good, it could be bad in some aspects. Good वहां पे जहाँ पे आप whatever कोई बंदा है उससे आप कुछ सीखते हैं, आप if you follow that, it's a good thing, you're doing a good job. At times आपकी situation थोड़ी different होती है. There are a lot of people, they would text me कि what is the best pathway for मैं US को pursue करूँ या UK या whatever, and my answer is I don't know. And you can watch my webinars, or we can have a call and discuss this. I don't want to mislead you. अभी मैं आपको एक बात करूँ, आपकी सिचुएशन से सूट ना करे, फाइनेंशियल हो, आपके फैमिली में कुछ इस तरह हो, आप मेंटली वो ना परसू कर सकें, इट्स नॉट आइडियल, राइट? आई डोंट लाइक टू गिव एडवाइसेस के मैं आपको कहूँ कि बस यूएस इज गुड एंड फॉर दीज रीजंस मेरी एडवाइस बायस्ड हो सकती है. What I personally do is मैं बहुत लोगों से मशवरा लेता हूँ, and then I take my own decision and try to think over it, and I mess up a lot. I make a lot of blunders and mistakes, and I lose a lot of time, a lot of money, a lot of energy in a lot of things, and then at the end I figure out that these things were useless and this is useful, and let's pursue this. And I would encourage whatever, figure out what works for you. लेकिन don't have a narrow vision. एक्सप्लोर करें डिफरेंट चीज़ों को. इफ अगर आप रिसर्च में अच्छे बनते हैं, एक्सप्लोर करें. व्हाट आर अपॉर्चुनिटीज इन रिसर्च व्हिच यू कैन गेट. आई टोल्ड यू अबाउट वन, एंड पीपल आर गेटिंग बेनिफिट ऑफ इट, एंड हमें पता ही नहीं होगा. तो स्पेशली हमारे लोगों को, और आई डोंट वांट टू बी बायस्ड, बट पुख्ताना चीज़ी नो आगे पदे खबर अजान न पोई, एंड वी नीड टू लर्न दिस. वी नीड टू नो कि हमारा टैलेंट कहाँ पे काम आ सकता है, एंड वी शुड टेक बेनिफिट फॉर दैट. वी शुड यहाँ पे आपको, इट्स अ वर्ल्ड ऑफ अपॉर्चुनिटी. एवरीवन विल पुश यू ओवर हियर टुवर्ड्स बेटरमेंट इफ यू हैव द स्किल्स एंड टैलेंट, राइट? तो बात लंबी हो रही है, बट टू समराइज, have diverse experience and knowledge and pursue different things. Don't follow a specific idea, a specific ideology, a specific organization, a specific thought of school of thought, a specific person or anything like that. अपने image को, अपने perspective of the world, have a very broad perspective and make it very adjustable, adaptable. कहीं पे आप जाते हैं, बी अ सोशल कमेलियन, उसके साथ उसके रंग में रंग जाए, एंड लर्न फ्रॉम दैट सिस्टम. उनकी तरह ना बने, but have your own values, value that whatever you have, your culture, but be adaptable. And you know what I mean by that. If you don't, you should work on this, and I think this will go places for you. It will take you very ahead in your career. एक अच्छा डॉक्टर बनने के लिए you can do a lot being an MBBS. So don't limit your opportunities. I hope that's helpful.
सर ये एक लास्ट क्वेश्चन है कि सर ये इलेक्टिव्स जो होते हैं सर, ये पाकिस्तान में इलेक्टिव्स सर, तो एनी
I would say again, any experience is a good experience. तो कोई experience आप learn करते हैं, it's good. I personally did one in Shifa. If you ask me, if you have a better thing to do, go for that and don't do it. अगर आपके पास और कुछ नहीं है तो फिर इट्स अ गुड थिंग. फॉर एग्जांपल यूएस में इलेक्टिव है और पाकिस्तान में आप यूएस जाएं, या आपका स्टेप 1 रहता है और यहाँ पे समर वेकेशन में इलेक्टिव है, आप स्टेप 1 दें. आप एग्जाम पे फोकस करें, आप रिसर्च पे फोकस करें. हाँ, आपके पास बहुत टाइम है एक्स्ट्रा, आप एवं ही चक्कर मारना चाहें, वो कराची जाएं, आगा खान जाएं, वहाँ पे 1 महीना 2 हफ्ते इलेक्टिव करें. लेकिन अगर आप जाते हैं तो गेट अ लेटर फ्रॉम इट, लेटर ऑफ रिकमेंडेशन लें, कुछ ऐसी चीज लें जो कि आपको फायदा दे करना. डोंट जस्ट गो देयर एंड चिल अराउंड एंड कम बैक. बट a lot of people are doing this these days, and they're asking me, my answer usually is 2 questions. Experience अच्छा होता है? Is it important experience? Answer is yes. Is it the best thing to do? No. And yes, depends on your situation. अगर आपके पास कुछ भी नहीं है और आप टाइम वेस्ट करें, द बेस्ट थिंग कुड बी टू बी इन हॉस्पिटल एंड लर्न समथिंग. लेकिन आपके पास अगर और अच्छी अपॉर्चुनिटी है तो डोंट वेस्ट इट ऑन लाइक वन इन अ स्पेसिफिक हॉस्पिटल. वो आपका अपना हॉस्पिटल उससे शायद ज्यादा अच्छा एक्सपोजर आपको दे, तो यू डोंट नीड टू मनी एंड टाइम एंड बी देयर एंड एवरीथिंग. Other than that, if anyone has questions, I have to attend another. We have a research meeting, but I shared my contact and as well as my email over here. So if someone wants to ask any question, I won't be able to respond right away. So please have some patience, but I'll try to. Be helpful. But if you can send me screenshots of the chat, then I can later
Yeah,
answer.
yes, sir. I will send it to you. You can answer it in WhatsApp group.
Yeah. Okay.
Yeah. So, sir, thank you so much for your precious time. तो आपका बहुत टाइम ले लिया हमने बहुत अपने क्वेश्चंस किए अपने जो अजीब अजीब क्वेश्चंस थे.
I appreciate you guys took out the time, and
सर और सर
I would
as
want
far
to
as
someone has a capability, and if I can push you and throw you into the air towards that, I definitely do that. I can be the वो नहीं होता वो spring you
yeah. Yes sir.
will throw you somewhere. You can have something good, inshallah.
Yes sir.
Walid
Sir,
sir, Walid sir, thank you so much.
You're welcome, Basit, and have a wonderful carry.
if someone has a question for sir,
Thank you.
so you can ask.
Yes, and Mikha, I have to leave. No,
Okay,
see
sir.
you.
Okay, sir. Thank you so much. Sir, you can
Bye-bye.
ask.
Thank you
Bye
very
bye.
much.
Allah Hafiz. Allah Hafiz.